Hi, we're here at Clinica Alemana with Lizzie Olivares. She's the Chief Nurse of Preventative Medicine and Patients Program Service for International Patients, as well as Vivian Sabat, and she is also a nurse. We will be talking about today is the International Patient Program here at Clinica Alemana.
This program is oriented to several groups of foreigners. Those who came to Chile from tourism or business, and they need different attention depending on normally emergencies. For example, during this period, skiing period, and we have for them also rescue 24 hours a day, and we gave them all of the necessary coordination for all their requests. The other is foreigners that are visiting Chile for medical treatment. Yeah, we came from different places. Sometimes Chilean that lives out of Chile in Canada and the United States, and they coordinate everything here for medical attention. And also foreign patients residing in Chile that they have different health benefits. They can afford every kind of attention here.
So what other languages do your staff speak?
German, French, Japanese. But we also ask for translators when we need translation.
So if you don't have one of the main languages, you can always find a translator that can help.
Yeah.
How could a patient, let's say someone who's just comes to Chile and they get sick or they hurt themselves, how do they come to contact and ask for this program?
We have a webpage. The clinic has a webpage, so you can link the International Patient Service, and we have a phone number 210-1301, and you can call us, speak in English, and we can help you by phone, or they can contact by the email pacienteinternacional@alemana.cl.
Okay, very good. And so they come in and they have someone who speaks English to them, or French or Japanese, and and you assist them to help make appointments or speak with. Is it just one? Do you have the same person that goes with you throughout your treatment or your stay, or is it the team of nurses and doctors?
No, the teams are nurses and doctors and assistants.
Okay.
And also we have a guide.
Okay.
They are young people, normally students at the university, and they help us to guide patients around the clinic to go everywhere we need.
Fantastic. And can you tell me a little bit about the insurance? Now, a lot of foreigners don't have Chilean ISAPRE, so can you tell me how, or if there is some help that you guys can provide your foreign patient to, submit their paperwork to their insurance company, or is there someone that can help?
Yeah, we can help them.
Okay.
And normally we work with all the insurance companies.
Okay.
Yeah. And the only important thing is that they be responsible for the payment. Yeah. And if we receive from the insurance the guarantee letter of payment, we can invoice the insurance directly. Yeah. Sometimes they ask patients to reimburse, to pay and reimburse the attention. Normally the outpatients do that way.
Yeah.
They pay and they reimburse. But we can also help them.
But there's someone that could help fill out the paperwork and pay their bill.
Yes,
and
everything.
Okay.
We can help them to do all the paperwork, and sometimes if it is necessary, we contact the insurance company to know exactly what they work.
Okay.
It's not necessary to have a formal agreement. work with the insurance company.
Okay. And then as of late, there's been a lot of foreigners that come to Chile to receive healthcare at a lower rate. Can you tell me more about that and how you deal with more medical travel, basically, where people aren't coming for visiting the sites, but more for medical reasons?
Yeah, we receive.
Is that the
patients.
majority for? Is that one of the reasons for the international patient program, or is it because of the amount of foreigners that live in Chile?
No, it's one of the reasons.
Okay.
We have because we have agreements with embassies, and also we have an agreement around 10 years with Falkland Island Hospital.
Okay.
And we receive normally patients from there and from other countries. And normally we prepare all the attention previously for the patients, and we contact and we send indications by email to have. Normally we try to do all in a very short period of time, because they come sometimes for 3 days, 4 days, 1 week, and we to do everything during
in those days.
Sometimes we work with them as an emergency service, because sometimes they come for one problem, but with the medical evaluation, they have another diagnosis, and we need to do another test, and we must do normally during the same day or the other day, but very short period of time to solve everything.
Very good. This sounds like a very, very fantastic program. So glad that you guys were able to share this with us today. I know for myself, being a foreigner in Chile, and many of my friends, this will be very, very helpful knowledge to know that they can come here and not have to be afraid of not understanding, and knowing that if whatever questions they may have, there's someone that can help answer them and help guide them through the processes that they're going to be going through. So, is there anything else you would like to share?
No. That's
Well, thank you very much.
You're welcome.
Okay.